Today, I'm going to talk about a basic concept of epidemiology. Okay, the I laws for this lecture, definition of epidemiology, which is very important, uses and purposes of epidemiology, epidemiological triad, natural history of diseases, epidemiological pattern of communicable disease occurrence, level of disease prevention. So, the epidemiology, okay, is derived from عبارة عن كلمة إغريقية, okay? And if we want to take each part of this word, the epi mean on, okay? Demos means people, and logi mean study or science. So if we collect these pieces together, the definition of epidemiology will be the science which deals with what falls upon people, okay? Also, epidemiology was defined in the past, the branch of medical science which treats epidemics. تقريبا قبل 200 سنة كانت في أوبئة منتشرة زي الكوليرا في لندن, and from this definition came, okay? But what is the modern definition of epidemiology? Okay. Modern definition of epidemiology is the study of occurrence and distribution of health-related diseases or events in specified populations, including the study of determinants influencing such states and the application of this knowledge to control the health problem, okay? Or simply we can say the study of distribution and determinants of health-related diseases or events in a specified population and application of this knowledge to control the health problem. So first one is about distribution. Okay, about the distribution. Distribution means or describes the frequency of cases, okay? Also refer to the pattern of disease according to the three things. These three things is person, place, time. أو ممكن نقول who, okay, where, when. Who is getting the disease, where it is occurring, and when. Okay. Health-related diseases or events. What does that mean? Is epidemiology only dealing with communicable diseases? معايا انتم؟ Good. Not only communicable disease, include diseases, either communicable or non-communicable disease, with injuries, with disabilities, with death, not just disease. Anything affect the health of the population يكون تحت هذه الجملة. Specified populations, including the study of determinants. Determinants is anything influence the occurrence of disease, okay, and other health-related states, and application of this knowledge to control the health problem. So, uses of epidemiology To determine, describe, and report on the natural course of disease, disability, injury, and death. البداية أول ما صارت حالات كورونا كان في دراسة natural course of disease. هذه حنوضحها إن شاء الله في النكست سلايد. To aid the planning and development of health services and programs. لما يكون عندنا مثلا distribution أو number of patient with diabetes راح نعرف كم نحتاج مثلا من الميديكيشنز. اوكي، لما يكون عندي مثلا نسبة عالية من السموكرز في مجتمع راح ممكن يكون عندي ايش؟ برنامج لمكافحة التدخين. Also to provide administrative and planning data. To study the cause or etiology of disease, تمام, which include to know the primary agent responsible for this condition, to determine characteristics of the agent, mode of transmission, contributing factors. كل هذه العام الماضي بالتفصيل كل item درسناه في الهيلث كير سيستم. What is the purposes of epidemiology? It is to prevent and control of disease. Any questions so far? So we have two types of epidemiology. First one is descriptive epidemiology, which is, as I mentioned before in the definition, related to distribution of disease in population. Okay. Analytical epidemiology about investigating the hypothesis about the cause of disease. So the first one is the basic triad of descriptive epidemiology. Okay. So we describe here related to person, place, time. Okay. نفس اللي قلنا في الديفينيشن. إذن distribution pattern. So we are here discussing about disease, where and when. So who is getting the disease? Personal characteristics. The first one, age. For example, is this disease common in elderly or it's common in children? Gender. Is this condition common in female, for example, systematic lupus erythematosus, or it is common among male, like that? Also, regarding socioeconomic status, education, occupation, income, as you know, some conditions is more, for example, common among people with low education level. Okay, while other diseases, for example, common among those with high education level. Second one is occupation. For example, some people maybe they have, for example, back pain because most of them are doing administrative job. Okay. Also income, as you know, poor people may have, for example, more common disease comparing to rich people. For example, like HIV, like TB. Also regarding for some prognosis of some chronic diseases, for example, cancer. Maybe people have mortality rate higher than rich people because rich people they have access for health services. Also, marital status. There is many paper published, for example, that maybe people who are married live longer, and so all of these are characteristics of personal, and we'll find that is the disease common event on each item of these. Okay. اذكر اني قريت مثلا بيبر انه حصل انه مثلا depression is common among a single men compared to all married men. Okay. ethnicity, race, genetic profile. مثلا معروف انه hypertension مثلا في امريكا is more common among African American compared to other groups. والbehaviors والhabits زي مثلا smokers or alcohol. Okay. Is that clear? All of these just descriptive. Okay. We just, for example, list the name of disease and characteristics. نفس الفكرة زي في بداية حدوث COVID-19. It just list of these characteristics ونذكر مريض مثلا hypertensive patient والage. وبناء على الأشياء هذه ممكن إنه بناء على descriptive, okay, we can formulate or generate hypothesis. The second one, place or where. Okay, maybe we'll find some disease restricted to one area. For example, climate effects. For example, common or some diseases more likely to be in high temperature and high humidity climate, like for example, malaria or dengue fever. Okay. Also, is this common in urban region or in rural region? Okay. For example, you maybe find some papers published that obesity is much higher in people who live in urban areas compared to people who live in rural area. Okay. And relation to environmental exposure, for example, like water, food supply, etc. The third one is time. For example, is this condition changing or stable? And time trend, it's point source or propagated. What is the difference between point source and propagated? أخذنا العام الماضي. ممتاز. مثال. المقصود البوينت سورس انه this when for example condition okay occurs in a brief period, okay, for example like food poisoning. Propagated is mean spreading from one person to another, okay, like infectious diseases. What about seasonal? ممتاز. انه عندنا بعض الديزيز معروف، حتى عندنا مثلا المملكه معروف انه بعض الاشهر اوكي عندنا مثلا الالرجيك رينايتس، برونكيال ازمه، الانفلونزا تزيد في بعض المواسم. اوكي. secular is mean that what about the disease over a long period, okay, over years. Is the disease trend is increasing or decreasing, okay? إذا لو تلاحظون الجزء اللي خلصنا منه related من الديفينيشن distribution إنه distribution describe frequency or number of cases and the distribution pattern which that's about three things: person, place, time. الآن نتكلم عن موضوع determinants أو triad of analytical epidemiology which okay describe host, agent, environment. Agent, it's this agent microorganism, biological, physical, chemical, environmental, or psychological experiences. Host factors. The first one is personal traits, which is characteristics of person. Okay. هذه حتاخذون إن شاء الله في MD2 في ال Human Development. في مثلا بعض ال personal characteristics مثلا معروف إنه type A personality أو الشخص اللي يكون إحنا نسميه عندنا يعني الشخص الحار أو اللي يكون مرة competitive مثلا مهم عنده الوقت يشتغل عادي 12 15 ساعة. بينما التايب بي بيرسوناليتي لا، الشخص اللي ريلاكسد وانجوينج او نسميه احنا يعني بارد. تمام. في بعض الدراسات اشارت انه البيرسونال تريت لها علاقه في او افكت ذا هيلث. اذكر اني قرات بيبر انه type A personality may be increase the risk of cardiovascular diseases due to high stress level. Okay. Second one is behaviors. Okay. Behaviors, as we mentioned before, about, for example, smoking or alcohol, okay, and genetic predisposition and immunological factors. Immunological factors is about is the person immune or not, okay? We have immune versus susceptible. So what do we mean by susceptible person? ممتاز. طيب المعرض للإصابة ممتاز. البعض دائما انه عنده مفهوم انه susceptible، وهذه دائما حصلة كثيرة انهم دائما الناس الاميونو كومبرومايزد فقط، وهذا غير صحيح. ممكن يكون شخص not exposed to for example infection and there is no vaccine، مثل ما اول ما صارت الكوفيد 19 كانوا الناس كلهم not exposed before to this infection وما كان في vaccine. او ممكن يكون الشخص exposed in the past، تعرض لهذا الشيء سابقا، لكن this disease can reoccur. اوكي. مثل الكومن كولد مثلا كل سنه يكون موجود او يصيب نفس الشخص. اوكي. او يكون immunocompromised. واضح؟ اي نقطه يا شباب رجاء ممكن تكتبون بالشات. اوكي. For environment living conditions like housing, crowding, water supply, refuse, sewage, all of these. Okay. So maybe you will find some, for example, condition increase the risk of some disease. مثلا معروف إنه crowded house conditions, okay, also increase the risk of tuberculosis, for example, okay. أو الناس مثلا في بعض الدول يستخدمون مثلا الحطب أو الأخشاب مثلا في تجهيز الطعام عندهم نسبة عالية من for example respiratory diseases. Epidemics occur when host agent environmental factors are not in the balance. For example, due to a new agent مثل حالة الكوفيد, due to change in existing agent, for example, infectivity, pathogenicity, or virulence, due to change in the number of susceptible in the population, due to environmental change that affect transmission of the agent. ممكن أحيانا susceptible number increase in population. بعض الدول مثلا في أفريقيا for example عندهم نسبة عالية من مرضى ال HIV. Okay. Okay. The next one is okay. Natural history of disease means refer to the progress of disease process in individuals over time in the absence of intervention, in the absence of treatment. Okay. So natural history of disease describes the course of the disease in individual, starting from exposure till one of the possible outcomes occur, سواء complications, سواء death. Okay. This figure is very important. Okay. Here is the stage of susceptibility. Okay. Here is the exposure and stage of subclinical disease. What is the meaning of subclinical? What is the difference between subclinical and the clinical disease? ممتاز. إنه here there is no sign, no symptoms, okay? But there is pathological changes. But still here there is no sign, no symptoms. Why? Here there is sign and symptoms, okay? And here is stage of recovery, disability or death. So natural history of disease, clinical disease characterized by clinical features, signs, and symptoms. Okay. No clinical disease may include the following. Okay. We have preclinical and subclinical. What is the difference between preclinical and subclinical? صحيح. ممكن يكونوا في incubation. Still, there is no sign and symptoms. Or ممكن يكون إنهم carrier. Okay. What is the difference now between preclinical and subclinical? ممكن أحد يعطينا مثال؟ Clinical disease is not yet clinically apparent, but will be clinically apparent. Okay, like what? For example, a person is look healthy, and when we take blood sample, then the reading will, for example, هيكون مثلا عنده the blood sugar level more than, for example, 200. So this is suggest what person is diabetic. Okay. ولو جلس سنة أو سنتين أو ثلاث بالأخير حتظهر عليه الأعراض. Okay. But what about subclinical? Subclinical disease that is not clinically apparent and it will not become clinically apparent. So we can detect those people with subclinical diseases by investigations. Okay. العام الماضي فيه قصة قلت لكم اقروها في الهيلث كير سيستم. أحد منكم يذكره؟ أحد منكم يعرف قصة ماري مالون؟ ماري مالون. أتوقع ماري مالون. أوكي. ماري مالون كانت تشتغل في قبل 100 سنة تقريبا في نيويورك. أوكي. وكانت without symptoms, no sign, no symptoms, and capable to transmit typhoid fever, okay, which is bacterial infection. So this is, for example of subclinical diseases. Now is epidemiological pattern of disease occurrence, okay? We have endemic, epidemic, pandemic, sporadic. The endemic is refer to what? Refer to constant presence, okay, of disease or infectious agent in a population. So here the disease is present. For example, مثلا كل سنة يسجل نفس العدد أو مقارب للعدد كل سنة مثلا من disease معين، مثلا for example dengue fever okay أو التي بي، فنعتبره هنا في هذه الدولة إنه endemic. تمام. What is the difference between endemic and epidemic? So the endemic prevalence for B0, okay? The second one is epidemic, okay? Refer to increase in the number of cases of disease above what is normally expected in the population, okay? أو ممكن إنه يكون new disease وأول حالة أو مجموعة حالات تظهر في مكان معين. We consider this as epidemic. So epidemic is increase in incidence. واضح؟ طيب sporadic refer to disease that occur infrequently and irregularly. حالة مثلا تظهر مثلا مكان معين بعد فترة مثلا طويلة تظهر حالة ثانية. This is we consider it as sporadic. Outbreak and epidemic, same concept, okay? But we use it usually outbreak for more limited geographic area. مثلا ممكن في مدرسة معينة تصير حالات مثلا زيادة في حالات الهيباتيتس A مثلا. Usually we don't say epidemic، نقول outbreak أو بالعربي نسميها الفاشية. تمام. أو مثلا ناس صارت عندنا حالة مثلا ستاف أوريوس، مثلا ناس أكلوا مجموعة مثلا أكلوا من مطعم معين وصار عندنا increase بالحالات مثلا 300 حالة كانوا. We consider this as outbreak. واضح؟ لكن عادة الابديميك يكون على مستوى مثلا دولة. تمام. دولة أو منطقة يكون شيء، لكن لما يكون limited geographic area we call it outbreak. This is only for infectious. لكن الآن أيضا حتى non communicable disease ممكن أصبحوا يستخدمون أحيانا these terms. A pandemic refer to epidemic that has spread over several countries or continents, like what? وأبعد like corona, like COVID-19. تمام؟ Any questions so far? ركزوا معي. Levels of disease prevention. Okay. We have primary prevention, we have secondary prevention, and we have tertiary prevention. Okay. So primary prevention is trying to what? To prevent people from getting the disease. تمام؟ Like health promotion, advise people to, for example, about proper nutrition, mental hygiene, all of these. Okay. Specific protection, like what? يعني primary prevention احنا نستهدف دائما الناس اللي عندهم يعني high risk factor او high risk. دائما يكون عندنا approach. ممكن مثلا الدايابيتس، خلاص الاشخاص اللي above 40 يكون نحاول increase awareness about the disease. حتى الان هم لم يصابوا بالبرايمري prevention. اوكي. من يعطي مثال على specific protection؟ ممتاز. الفاكسين. الشخص الآن يأخذ الفاكسين قبل يصاب disease. So this is one type of primary prevention. Another one، مثال ثاني ودائما يغيب ما فهمت، ممكن توضح أكثر؟ ممتاز. hand washing، الماسك. طيب في specific protection، الكيمو بروفيلاكسس، سبق ومرت عليكم أو لا؟ كيمو بروفيلاكسس المقصود فيها إنه we give for example a patient with ممكن ناس contact with a patient with meningitis. تمام؟ نعطيهم antibiotics as a protection. واضح؟ شخص صار له contact مع مريض عنده meningitis. تمام؟ الشخص هذا الكونتاكت يعطيه protection as antibiotics to prevent meningitis. واضح؟ طيب the second one is secondary prevention. Secondary prevention, early detection and intervention before the condition is clinically apparent. What does that mean? So in secondary prevention, is there symptoms and signs of the patient or not? Or be person or no? So they are symptomatic. Okay. أشهر مثال screening. ممتاز. For that we do screening for them. مثلا بعض الحملات اللي قاموا فيها زملائكم إنهم try to for example يروحون بعض المولات يحاولون يحصلون الناس اللي for example diabetic. حتى الآن الشخص هذا زين is no sign and symptoms، ما يشكي من أي شيء، لكن يحصلون حالات مثلا إنه يكون عنده إيش؟ diabetes ما كان يدري عنه، أو hypertension. نفس فكرة colorectal cancer screening, breast cancer screening, all of these. Okay. Last one is about what? Tertiary prevention. Now, هل نقدر نقول asymptomatic أو symptomatic؟ symptomatic. تمام؟ شخص الآن عنده سكر وجاء للعيادة عنده أعراض، احنا الآن أي ليفل في البريفنشن؟ tertiary prevention. ممتاز. الفكرة إنه to improve what؟ إنه improve quality of life, decrease the symptoms of disease, we try على حسب الديزيز. تمام؟ وأيضا في medical ممكن نحتاج medical rehabilitation, social rehabilitation. نفس الفكرة اللي أخذناها سابقا. البرايمري بريفنشن وين حتكون؟ هل حتكون هنا أو هنا؟ ممتاز. stage of susceptibility حتكون فيه البرايمري بريفنشن. secondary بريفنشن هنا sub clinical. ممكن أحد يسألني يقول طيب الدكتور كيف نعرف ولسه الشخص ما عنده sign or symptoms؟ زي ما قلنا screening، ممكن نعمل بعض investigations، ممكن نحتاج بعض for example mammogram for example for breast cancer etc. Okay, so this is secondary prevention. Onset of symptoms we are moved to what? tertiary prevention. واضح؟ Any question؟ أحد عنده سؤال؟